Oh, so the red is the side of your index finger? It's the, yeah, key pinch. There you go.
Oh, gotcha.
Hello, this is the scholarly project entitled Virtual Reality, an Evidence-Based Guide for Occupational Therapy, completed at the University of North Dakota. I'm Grant Mitchell.
And I'm Kyle Nelson.
And our advisor was Dr. Jansen. To get started, we both chose a topic we were interested in, and that was virtual reality. And so this project really was comprised of two literature reviews. The first one was just looking at what existed, and our initial hypothesis was that there would be a lack of literature due to the novelty of this new technology. But what we actually found was that there was a lack of organization and a need for manuals and resources, and that therapists had a difficult time implementing VR effectively in practice due to the lack of time and knowledge. We wanted to design a guide to implement effective use of VR in practice, and this guide was to be evidence-based, usable, easy to follow, common, and accessible technology. And we really wanted to focus on that accessibility piece of it.
The first step in the creation of our product was performing a rigorous review of the literature focused specifically on the use of the Xbox, Kinect, and the Nintendo Wii in therapy. We searched 5 databases including Academic Search Premier, CINAHL, PubMed, OT Search, and Scopus. Our search parameters included the terms Occupational Therapy and Wii, Occupational Therapy and Xbox, and Occupational Therapy and Virtual Reality. The articles were published after 2005 and within the English language. Further inclusion criteria required the articles to be an original research article to address the use of the Xbox and/or the Wii, and that they related to the domain of occupational therapy as described by the OT Practice Framework. Within the literature, there is an abundance of resources. A portion of this literature pertains to the use of virtual reality systems in occupational therapy, and an even smaller body of literature when narrowed down to the specific virtual reality systems of the Xbox Kinect and the Nintendo Wii. We reviewed 2,045 articles that were retrieved during our search and narrowed it down to 69 articles that met all of our inclusion criteria. We utilized the Occupational Therapy Practice Framework Domain and Process 3rd edition as our guiding framework for the development of our product. We chose this because it is familiar, it is organized, and usable in universal application to the practice of occupational therapy. Our product contains 7 sections. The first 5 sections pertain directly to the 5 main aspects of the domain of occupational therapy, which includes occupations, client factors, performance skills, performance patterns, and context and environment. The 6th section contains assessment tools, which may measure a combination of any of the previous sections. The last section contains case scenarios, which provides examples of how to integrate the previous 6 sections into practice. Using our 69 articles, we located the results and broke them down into individual units, for example, balance or coordination. We also noted which VR system was used, the population being researched, group comparison, the results pertaining to that specific unit, and the level of evidence for the article. These authors studied balance, routine exercise, and the activity-specific balance confidence scale. We took the results from balance and placed it into the client factors section, routine exercise results into the performance patterns section, and the results of the activity-specific balance confidence scale went into the assessment tools section.
With the literature organized in sections, we could implement this guide into OT practice to make the evidence accessible to OT practitioners. And we found in our literature that there were positive outcomes in a variety of populations. These outcomes related to motivation, social interaction, and movement-based activities such as upper extremity coordination or strengthening. These systems were feasible and safe and accessible. The first being that we limited this guide to 2 systems, the Xbox and the Wii. Secondarily, client perceptions may negate the efficacy of use of virtual reality in clinics just due to preferences. We did not include an additional practice model as we used the OT practice framework, And this technology changes rapidly. Due to this, we recommend that this product does not remain static, meaning that it is continuously updated as technology changes. We recommend a qualitative study on the product implementation in clinics. Did practitioners find this useful? Followed up by a quantitative study on the efficacy. Did this decrease speed or increase the effectiveness of using VR in practice? And that as this product is updated, alternative systems be incorporated.
In conclusion, virtual reality is an effective treatment modality as supported by the literature. Virtual reality is also a context within which occupational therapy may take place. It is important for therapists to utilize clinical reasoning, as not all of the literature supported the use of virtual reality. And lastly, occupational therapists must utilize evidence-based practice to guide their practice, which can be done through the use of our scholarly project.
If you want more information, you can contact me, or you can check out my blog at theotpreneur.com, like my Facebook page, check out the YouTube channel, or follow the Twitter, and I will post updates on the progress of this product.